This audio overview was generated using AI for educational purposes by Carey Family Dental and does not replace a consultation with your dentist. So, have you ever wondered how dentists fix a tooth that is broken, like almost entirely below the gum line, or how they balance out a gummy smile?
Yeah, it is a fascinating engineering problem, honestly.
Right, because today we are doing a deep dive into the surgical procedure known as crown lengthening. We are going to look at the clinical facts on why it is done, the risks, and the alternatives to it.
And to really understand why someone would need this, we first have to understand what it physically changes in the mouth. I mean, crown lengthening is literally a surgical procedure where we intentionally lengthen a tooth by removing some of its surrounding bone and gum tissue.
Which sounds intense, but there are basically two main reasons for doing it, right? Function and aesthetics.
Exactly. On the aesthetic side, you are correcting that gummy smile. You alter the bone and gum levels just to expose more of the front teeth.
Purely for the visual balance.
Right. But the functional side is when a tooth is heavily damaged. Like, say you have a subgingival margin. That means the tooth is decayed or sheared off below the gum line.
So there is literally nothing there for a new crown to grab onto.
Exactly. You cannot bond a ceramic restoration to a buried, bleeding stump and expect it to survive everyday biting forces. So removing that bone and gum exposes enough healthy tooth structure so the new restoration actually has something solid to attach to.
Okay, so if the tooth is a house, crown lengthening is basically excavating the yard so you have enough solid foundation to build a brand new roof.
That is a perfect way to look at it. You have to alter the landscape. But because you are altering bone and gums, it is a true surgical intervention.
Yeah, we need to talk about the risks of doing that versus, the risks of doing nothing at all.
Well, the standard surgical risks are definitely there. You are looking at bleeding, bruising, swelling, infection, maybe some issues with the local anesthetic, plus tooth sensitivity.
Because you are exposing parts of the root that used to be covered up.
Right. And there's another big factor. Dropping the bone level around one specific tooth kind of destabilizes the immediate neighborhood. It creates this localized slope.
Wait, slope? Like the gums just dip down.
Yeah, when you reduce the height on a target tooth, the tissue of the neighboring teeth naturally dips down to meet it. That new gradient can actually expose the sensitive roots of the adjacent teeth, or even uncover the rough margins of older fillings nearby.
Oh, wow. So you could be causing collateral damage to perfectly fine teeth right next door.
It is a risk you have to weigh.
Wait, so the alternative to this gum surgery might actually be losing the tooth entirely or having to get braces. I mean, what are the other options here?
You basically nailed it. One alternative is extracting the damaged tooth entirely, which means you then need a replacement. The other alternative is using orthodontics.
Like braces, just for that one tooth.
Yeah, it's called orthodontic extrusion. You literally pull the broken stump further into the mouth over a few months.
That sounds wild. You just yank it upward out of the bone.
Very slowly, yes. But it avoids the surgical slope issue entirely because you are not cutting the bone. You preserve the tissue levels of the neighboring teeth.
Okay, but say I do not want surgery and I definitely do not want braces. What if someone just ignores it and leaves the broken tooth buried?
Then ignoring it usually results in the premature loss of the tooth. It simply cannot be cleaned properly, it cannot be restored, and the decay will just keep progressing down the root.
Until extraction is literally the only option left.
Right. That is why functional crown lengthening is far more than just some cosmetic tweak. It is often a critical structural rescue mission for a failing tooth.
It really is. It makes you realize how much of your overall dental health relies entirely on this invisible architecture of bone and gums hidden right beneath the surface.
Absolutely. Without a solid yard, the house eventually collapses.